Hi, I'm Dr. J. I am a doctor of physical therapy and a licensed physical therapist, and I'm going to be walking you through the steps of a total knee replacement today. Everything from treatment to pain relief to question and answer and everything else you might run into along the way to make this process better for you. So, in the first phase, these 2 weeks, the most important thing is motion. We're really going to be focusing on bending and straightening that knee. Those are the key pieces, especially for these first weeks. But we want to make sure that by 6 weeks, we're at about full motion. So we'll be starting with that today, and we're going to go from here. One of the best things that you can use beginning your therapy after a total knee replacement is a stationary bike. Now, the tough thing with this is sometimes getting on a stationary bike like this can be difficult. So if you have a recumbent one where you kind of got the seat you can sit in and have your feet out in front of you, that's a great option. Also, if you are in a community or have a gym membership and you can use a new step, those are great. You can sit and they kind of pedal back and forth. Those are great machines to work on this as well. But you'll find that as you're trying to bike that you can't do normal biking. It's going to be different than you normally would do it because you can't make a full circle like this right now. It would be very painful. So what you're going to do is imagine this left leg is my leg that just had surgery. I'm going to be here and I'm going to come up as far as I can, and it might be just like that and back down and up and back down. And the goal of this is to slowly get further and further. And you'll be going, and hopefully after a couple weeks you'll have this magic moment that you keep going and you keep getting further and further, and then you make it all the way around. And that's going to be a big day when that happens. So keep working to get around, but it may take time. Like I said, anywhere from 2 to 4 weeks to get there. But keep going at it, and this will be a good way to help with your motion. Plus, it's just a nice way to sit here for 10 minutes and slowly work at it. And that way it'll get looser and looser as you go. We're going to be going through some exercises now, and as we talked about, we're really focusing on motion. Now this is my lovely assistant Brittany, who's going to be helping me with the process throughout these videos. The first thing we're going to work on is bending the knee. Now this is going to be the easiest position to start from, is laying down. And what it's going to be, we call this a heel slide, because your heel is going to slide along the table as your knee comes up and back down. Now, your knee's not going to move as easily as Brittany's is right now, but that's the goal. It's just little movements up and down. You're going to want to do as many of these as possible during the day. So I'm not going to give you a 2 sets of 10, just do a lot of them. Try to do at least 3 sets of 15 in a day. These are very painful at the beginning, not because they're damaging anything, but because it just hurts to move that knee initially. Now I'm going to add one thing to this, that as you get better at it and as it gets more comfortable, you can grab a belt or a rope or something else, and it's going to help you with this process. So for Brittany, I'm going to put it around her foot here, and I'm going to have her sit up and grab this. Now if you have a longer rope, you can still lay down and do this, and that might benefit you. But this way, as she brings that knee up, she can pull with her arms and get a little extra force. So just back and forth like this. And you don't have to go this fast. Go as slow as you need to make it tolerable. The more you do this, the better that motion is going to be, and the faster your motion improves, the faster your pain will improve as well. So for this next one, this is again to help bending the leg so that you can get it a little bit further. Now this one, you're probably not comfortable doing it first because most people don't like to sit at the edge of a table after a knee replacement. It's kind of an uncomfortable position. But after you've been doing some heel slides and you're getting more comfortable with this, you're going to be in this position and you're just going to take this leg and bend it under the table as far as you can go. Now we've got a little bar here blocking us, but you're not going to get that far right now, I promise. Now the goal is just to slowly bend it back and forth, just getting to where you can, and that's going to be a great start. I would say do this as often as you can again, at least 4 sets of 10, but again, do it a lot. For this next one, we're going to work on straightening the knee. Now, Brittany's knee is already pretty straight here, and so she's got a good spot. But I'm imagining that for you, your knee's probably starting out somewhere like this, and it's not feeling too good. So what you're going to do is you're going to tighten the muscles on top of the knee, and you're going to imagine that you're trying to smash my hand here. So Brittany, kind of imagine, yeah, just like that. Perfect. So you're pushing down, trying to smash my hand. And as you do that, it forces your knee into a straighter position here. So that is one of the most important things, is getting your knee all the way to what we call 0 degrees or straight. Because if it gets straight, you will walk fine, everything will go fine throughout the process. But if it doesn't get straight, then it's going to be a long, long road from here. But you have 6 weeks to get there, or even a little bit more if needed, so just keep working at this. So push down towards my hand. It's going to get these muscles to contract, and it's going to get the knee to straighten out here. So let's do a couple of those, holding for about 5 seconds each time. Perfect. So this is the goal, slowly getting straighter and straighter through these contractions. Now, as you do this, again, I can tell you do 2 sets of 10 or 4 sets of 10. Do at least 4 sets of 10 of this every day. But do as many as you can. The more you do, the faster you will get better on this. Now for this next exercise, if you can even call it that, really, this is just a good way to work on the knee straightening when you're at home, watching TV, a movie, reading a book, sitting down, whatever it might be. Basically, it's just when you're in a chair, you take your leg and you put it out over another chair or table, like this. Now this is a pretty high angle, but if you can start lower and work up to this, and it's going to help with the straightening of that knee. Now as part of this, you can add in, I'm going to have Brittany go ahead and just tighten that muscle. Perfect. We're getting extra motion there, getting a really good movement of the knee. Now this is going to be uncomfortable, so start doing it a minute or 2 minutes at a time, and then build up from there until you can do 5 or 10 or 20. And it's even easier to do if you're watching a show you like. Then you'll get distracted and forget that you're doing it so much. All right, for this next exercise, what I'm going to have Brittany do is it's basically just going to be a simple kick out of the leg, working on, again, getting that straightening. So Brittany, what I'm going to have you do is just kind of slowly just kick your leg out straight from the table there. Perfect. And back down and back up. And just kind of keep doing this for a minute. Now as you do it, there's no speed limit. Your goal is to go slow and take it at a comfortable pace, just slowly getting a little bit higher each time. This is going to both strengthen the muscle just a little bit, but really it's for motion and on building that ability to get there again. Now this next exercise is a pretty simple one, but it's very important. After a surgery, you're at a higher risk for blood clots, and we don't want any of those to happen because that's a big deal. Now, especially with the pain you're having in your knee, you're going to be sitting a lot. Because of that sitting, we want to make sure the blood keeps pumping. Now, blood pumps up your legs as you use them. And so if you're sitting, it's not really pumping very well. It's kind of a bad conundrum you get stuck in. So what I want to make sure you do is anytime you're sitting, do some ankle pumps, which is basically just bringing feet up and down. Pretty simple to do. And especially focus on pointing those toes all the way down when you're doing it. As you do this, you'll avoid getting blood clots. You'll be much safer with this. Pretty simple. Now, one of the most important things that you're going to want to do, especially in this first phase, is just walk a lot. Your body's going to tell you no, you can't walk, you can't do it. Say yes, go out, get some walking in, even if it's just around the house, as often as you can. It's going to help build that motion and the strength. I'm going to show you a couple things so that you're able to get around a little bit better and so your gait doesn't get too awkward as we're going through this phase. So this next piece is going to be how to go up and down stairs in your own house or wherever you run into them in the community. Now there's an easy way to remember, and the walker is going to make it a little tricky for sure, but the best thing you can do is if you've got a handrail here, you're going to go up stairs with the good and down with the bad. So what does that mean? Let's imagine that my left leg is the one that had surgery, my left knee. So that means my left knee is the bad one, even though it's going to be good someday. But the right leg is the good one right now. So as I go up the stairs, I've got my hand on the handrail, right leg goes up with the good, weight through. That way your left leg doesn't have to support you as you push up. Another step, up with the good. It's going to be a lot easier that way. Now for this next piece, it's going to be going downstairs. I know you think going downstairs, that's going to be easy, right? Gravity's on your side. It's not easy. Going downstairs is actually one of the hardest things to do for a knee. So what I want you to do is remember down with the bad. And what that's going to do, you get a little lean forward, grab your handrail here. Left knee is my surgical knee. So I'm going to go down with that. And while it's going down, all of the weight, all of the strength is in my good leg. So I can step down here with the left one, and then I can quickly move that right one. It's going to make it a lot easier going down initially. Again, down with the bad, and step forward. It's going to be safer, it's going to be more comfortable for you. Couple other things that are going to happen while you're walking. First, you're going to be tempted to walk. Now imagine I've got a walker here. You're going to kind of walk with this stiff leg. And your knee's not going to bend. You're just going to kind of do this thing. That's not good. It's okay if that happens, but try to focus on getting that leg to kick out straight when you walk. So you kick out straight and you get the heel. And then as you step, you kind of come back here too. So you've got that flow. I'm going to use the other leg now. So you're kicking out straight, coming back, and bending here, and kicking out straight again. Just make sure that knee is still moving while you're walking, and that it's not just a stiff knee moving along with you. So the next piece of this is just as you use that walker that you're definitely going to be starting out with, just slowly try to decrease the amount of pressure you're pushing through with your arms. At the beginning, just use whatever you need to, but as you get after a week or 2 or 3, you're going to put less and less pressure through your arms. And what's eventually going to happen is you're just going to kind of use the walker for stability and gliding. You'll kind of just walk the walker and it'll slide with you as you go. As you're able to do that, that's when you know that you're ready to use a cane instead. Because with a cane, you'll have just a little bit of pressure and support here in case the knee buckles, but you're not using it to really walk through. Because if you're using that to really push and walk, you probably still need a walker.